Hello, my name is Dr. Melanie Wilcox, and I'm an assistant professor at Augusta University in Augusta, Georgia, where my research focuses in part on the student loan debt crisis. Thank you for joining and the American Bar Association for hosting this week of action on student loan debt. As policymakers continue to grapple with ways to address economic inequities and disparities, this event is timely, as issues related to student loan debt must be included in these conversations. Student loan debt has surpassed credit card debt in America. As we speak, nearly 43 million borrowers with federal student loan debt and approximately 2.4 million additional borrowers with private student loans have a collective outstanding balance of nearly $2 trillion. With the overall amount of student debt increasing substantially since the Great Recession, millennials are now the most highly educated, most student loan indebted, and poorest in terms of both income and wealth generation to date. Much of this borrowing is being driven by increasing costs of living rather than direct educational costs. For graduate and professional education, however, it's often both. Thus, a significant portion of overall debt is carried by borrowers with graduate degrees. Data show that psychology graduate students report having difficulties affording healthcare, some work the equivalent of 2 full-time jobs, are concerned about being able to afford completing their training requirements, and have difficulties focusing on their studies and their dissertation as a result of trying to make ends meet. At the same time, demand continues to grow for careers where an advanced degree is required at the entry level, many of which are also in public service. This includes psychology, education, nursing, social work, and law, among others. For example, even before the pandemic, data showed that the need for licensed mental and behavioral health professionals remains great across the country, with every state having documented mental health professional shortage areas. The national shortage of psychologists is expected to be approximately 14,300 by the year 2030. Rural communities are especially in need of mental health providers and face serious challenges in recruiting licensed professionals. Student loan debt only complicates efforts to close these gaps, and actions taken by the federal government over the last decade disproportionately impact graduate students. This includes the imposition of higher interest rates and multiple loan origination fees, as well as the elimination of subsidized federal loans. Without access to these subsidized loans, graduate students begin accruing interest immediately upon disbursement of the loan, which is then compounded and added to the principal balance. These factors further increase the cost of federal borrowing, particularly when financing graduate education. Further, while most students are impacted by student loan debt to at least some degree, students of color, women, first-generation students, and lower socioeconomic status students are most greatly affected, needing to borrow much more to finance their education, both for their undergraduate and their post-baccalaureate degrees. This results from both generational wealth gaps as well as ongoing barriers, and serves to further widen historical racial wealth gaps and impede workforce diversity efforts. This inequity impacts a number of professions, including the mental and behavioral health care fields, where demand for representative, culturally responsive providers is high. Data show that low-income students and students of color working toward doctoral degrees in psychology tend to borrow more when financing their education. The prospect of adding further debt often serves as a disincentive to pursuing advanced degrees. Debt also impacts life and career choices, such as starting a family, getting married, buying a home, or pursuing a career that one might be passionate about. This affects student loan borrowers across all occupations, but especially those in public service, as compensation in public service tends to be lower as compared to that of the private sector. Students and early career professionals, especially those who are first generation or from a lower socioeconomic status background, report a greater likelihood of delaying these major life milestones, specifically due to their student loan debt. Finally, there's a psychological component to debt. Research shows that it contributes to stress, anxiety, depression, and other mental health concerns, which have only been exacerbated by the pandemic. The burden of student loan debt further increases future economic uncertainty for many students and borrowers, including those training to be the next generation of behavioral health providers and researchers. First-generation students and students from lower socioeconomic status backgrounds in particular experience greater personal and professional financial stressors during their graduate education. It is clear from the research that it is essential for policymakers to hear statistical, empirical, and anecdotal evidence of the impact that student loan debt is having on borrowers, families, the workforce, and the public. Engaging in this week of action is critical to those efforts.